Sure. Good morning, everybody. I am Jason Grumet. I'm the president of the Bipartisan Policy Center, and it's a real pleasure to have the honor to welcome you this morning to the launch of our Leaders Project on healthcare. I'd like to just take a couple of moments and give you a little bit of a sense of the Bipartisan Policy Center and how this project situates into our broader efforts and aspirations. The Bipartisan Policy Center was formed formally about a year ago around, I think, the reasonably simple idea that through serious analysis and aggressive advocacy, we could try to bring back a concept to Washington that had been a bit on retreat lately, and that's the art of principled compromise. We are decidedly the Bipartisan Policy Center, which is to say we are not the non-partisan policy center or the proto-post-meta partisan policy center. This is not about getting people together and holding hands around a circle and saying, shouldn't this be easy? This is recognizing how difficult it is in a real democracy to form good public policy. We accept and embrace the notion that politics is and should be a contact sport. With the leadership of Senators Dolan, Mitchell, and Baker and Daschle, we also embrace the ideal that there are moments in our democracy when we in fact can sit down, argue together, and come up with an idea that doesn't ask anybody to betray their principles, but finds a way to act in the best interest of the country. And that is the fundamental idea that underlies this effort. We have 4 projects underway right now. We have an effort to focus on energy policy called the National Commission on Energy Policy that was actually the predicate for the broader exercise. That project's been underway for about 6 years. We have a series of projects on important challenges in national security. We have a very senior group led by Senators Dan Coates and Senator Chuck Robb focusing on the challenges with Iran nuclear development. General Jim Jones, the former Supreme Allied Commander, is leading a project that looks at the challenges of stabilizing fragile states and the military-civilian roles and instruments we have at our disposal. We have a project focused on transportation and infrastructure that's co-chaired by former Senator Slade Gorton, Representatives Boehlert and Szabo, and former Governor Mark Warner. And we have what really is the signature project for the organization, which is what we're going to talk to you about today, which focuses on healthcare. When the organization was launched about a year ago, the 4 senators came together, and in addition to seeking to advise broadly the overall activities of the exercise, they had the shared sense that there was an opportunity for the 4 of them as individuals to put their collective histories and imaginations together and take on one real problem themselves. And we spent quite a bit of time trying to figure out what that could be, because I think it's no mystery that the opportunity to have the 4 of these gentlemen actually sitting around the table together trying to hammer out a tough issue of the day is a pretty rare gift. And we wanted to make sure that we had thought very carefully about how to channel that effort. And after some discussion, it was clear that healthcare was the issue that we all agreed deserved and merited that kind of focus. And so we are here today to launch this project. We come to you with no illusions of grandeur or that this is going to be something that we will be able to independently solve or fix. We are cognizant of the tremendous efforts out there already. Many of you in this room are leading those efforts to try to bring together new ideas and new coalitions to move the discussion forward. Our hope is simply that we can step back from that discussion and try to put together a set of principles, a framework that will improve the terrain of the debate, so that when the Congress and the next president come together, they'll have an opportunity to hopefully have a somewhat more substantive, somewhat less rhetorical, and somewhat hopefully more meaningful discussion. Now they turn off the air conditioning. So it is my real privilege and honor to ask Senator Dole to come up and give us a little bit of his sense of where this project's going. And again, I thank you for coming.
Well, thank you all. I have a voice strong enough to run for office. Well, thank you all for coming, and I recognize a lot of familiar faces here, and people know more about the issue than I do, not as much as Senator Mitchell does, but more than I do. And just before I came over, I picked up Senator Daschle's book. He has a book on the crisis in healthcare, and the book kind of starts off with a quote. And when you think about it, you think, well, that must be fairly recent. It was a quote from President Truman about how we needed to address the issue. So it's been around for a while. And I think the four of us, the four former leaders, we've got everything but votes. We don't have any votes. Yeah, but we do have some friends, and we do have some ideas, and we've got some great people helping us, and they'll be speaking a bit later. Plus, we got a lot of the people out here and in other places around the country that are, it's not the only group looking at what the problems are in healthcare. So Senator Baker could not be here today, and Senator Daschle cannot be here, but you know, we're sort of working together, doing what we can. And I think we decided about a year ago, as Jason's already said, to devote a lot of time to major issues, and this is one we all agreed on that needed sort of immediate attention. Senator Daschle and I spent some time on farm legislation, but you know, it was a little late to make much of a difference. But we all know there are flaws in the healthcare system. We all know there are different ideas on how to fix it. And people want different things. And I'm not going to mention any hot buttons because we don't have any hot buttons. We're not, at least it's not our intent to say anything that would lead anybody to believe that we've sort of we're kind of moving in this direction or that direction. So what we don't want to do today is just sort of launch our healthcare reform initiative called the Leaders Project. And our goal is to develop parameters for reform to provide the necessary policy foundation to address the delivery, cost, coverage, financing, all these challenges that face the healthcare system. And we all agree, there's no doubt about it, that Americans deserve better opportunities to improve their health. So we've all had some experience in our careers with dealing with, I remember working with Paul Rogers years ago. He knew more about it than I did, but bipartisanship, which is key to anything. But when I was in the Senate, I was chair of the Finance Committee, where I spent quite a bit of my time working on Medicare and Medicaid. But even before, back in 1979, there was what we call the Dole-Danforth-Domenici legislation, which people look at today, they might think that was kind of radical back in 1979, because it had a lot of things that we thought, what today I think people are talking about, but I'm not going to. But it was called the Catastrophic Health Insurance and Medicare Improvement Act. Good name. It had a three-pronged strategy involving Medicare recipients, fully employed individuals and families, and low-income families, those eligible for Medicare and Medicaid and assistance in financing. So, you know, for that period, it was maybe a little ahead of its time. And then this past year, I had the privilege of serving with former Secretary Shalala on another health care commission, but this was related to veterans health care. And so you not only look at the private sector, we were looking at the government sector, the DOD and the VA. And I would guess, and there are probably some here who could confirm or deny, that the VA health care system must be the largest health care system in the world. You got 25+ million veterans, 100 and some hospitals, and all the hundreds of other places. And they do about 6,000 amputations a year because of diabetes and other things. And so, you know, it's a big, big federal system. Now, some people complain about it. I think Secretary Shalala and I have found one thing, that first, we do give first-rate care. I don't think we found a single patient who complained about the care. It wasn't the care. It wasn't the doctor. It wasn't the nurse. It wasn't the therapy. It was that next step. It was the benefits or getting appointments after you'd been discharged and things of that kind. So we've had that experience with that part of health care. But we still got to find some way to find some solutions to these challenges that we read about every day. Some are accurate, some may be a bit exaggerated, some may have never happened, but there are plenty of good ones out there that have happened, and we need to find some answers. And you don't have to go very far. in your home area or wherever you live to find somebody with a problem. So I think you get troubled by a lot of things in the system, but it's the cost. I'd put way up there. How do we deal with it? How do we pay for it? How do we finance it? And you got premiums getting higher and higher, and it's affecting everybody, including consumers and business and everybody else. So I'm just sort of trying to shorten this as I go, but our work is driven by the moral imperative to help those who can't get the quality, affordable health care that they need. But we're also motivated by economic interests as well. And there exists an overwhelming sense in the business community that healthcare reforms are necessary to make the system more efficient and value-oriented to ensure that they can be competitive domestically and internationally. And I think that, is sort of what we're all about. And let me just move on. When I stand here today, kind of launching this Leaders Project, it takes me back to 1983, which some of you, some of you remember 1983, but we were trying to get Social Security put together then. And we had a Greenspan Commission. I had trouble understanding them too, but he was chairman. And we had all these people on the commission, including me and Senator Moynihan. And the commission was falling apart, and I just remember this one little thing on January 12th, 1983, when the Senate came back. We kind of got together and for almost simultaneously said, we can't let this happen, because if the commission collapsed, checks were going to start coming out late that July. And so, again, I use the word bipartisanship. And we got another person together, another person, pretty soon we had them all. And we had to please people like Tip O'Neill and Ronald Reagan. And we did. Nobody liked the bill. It raised taxes a little bit, raised the age. So when we're looking at health care, there are no easy things, there are no easy fixes, or that have been done already. And been a lot of patchwork and a lot of Band-Aids. And I don't believe that's what this audience or the American people, particularly the consumers, are looking for. So, they said with Social Security it was bankrupt, it couldn't fix it. Well, it's going to be around good till 2017. It's a very sensitive political issue. So is health care. Nobody wants to back into a buzzsaw unless absolutely necessary. And again, I'm just pointing out all the things you already know about. This is something that's going to be very difficult. So I think we also learn, at least I've learned from my own experience, that sometimes you can't make it on your own. Sometimes you have to ask for help, care how independent you are. And you have to kind of build a bridge between failure and success. And you get a little older, you discover that they're not polar opposites, they're just part of your life. And you can't win them all, but you learn a lot from failures. And it may help you be more successful the next time out. And again, it gets back to what we've been doing. I remember Senator Mitchell kept us in session part of August to try to reach a compromise. Didn't quite make it. But again, it is to point out, it's not going to be easy. Well, I'm going to turn the program over to podium over to my colleague and friend, Senator Mitchell. We've been friends and colleagues for a long time, along with Senator Daschle and Senator Baker. And we've demonstrated that we can have disagreements without, being disagreeable and all that stuff. And we can try to work things out. And had some success at it. I also want to recognize the support we've had from the Robert Wood Johnson Foundation. And as you know, they've had a long history of working to ensure that all Americans have stable coverage. And I want to thank also someone who still gives me advice, and that's my former medical chief of staff and all that, Sheila Burke. Where's Sheila? She's out here somewhere. In fact, I told President Clinton when he sent his bill to the Hill, if you can get Sheila to vote for it, I'll vote for it. So, because she knew more about it than I did. So, but she was a big help to me, and I'm hopefully going to be able to volunteer some time. So, Senator Mitchell, now you can give them all the real inside skinny. Yeah.
Thank you, Senator Dole. It's a pleasure to see you again, and I look forward to working with you again on this project. And thank all of you for your attending this announcement. It's a pleasure to be here today with so many friends as we undertake what I think is a most important task. Before I agreed to take up health reform again, Chris Jennings called me and asked that I re-engage on this issue. He said, if you can help get peace in Northern Ireland, surely you can help get health care reform in the U.S. I said, but health care is a lot harder. Well, I'm here not because my assessment was wrong, but because I think we may have entered a period when, as to health care reform, the seemingly impossible has become possible. Large numbers of health care stakeholders, including the business community, agree that we must reform our healthcare system now rather than allowing the current negative trends to further undermine it. And we're seeing a growing number of Americans recognize that failure to act has more severe and negative consequences than allowing the status quo of cost increases and declining rates of coverage to continue. That's why surveys consistently rank the need for meaningful health care reform among the top domestic priorities of American voters. I'm optimistic that there is now a real will to act so that all Americans will have quality and affordable coverage. I'm realistic about the challenges we face. As compelling as the arguments are for change, it will not come easy. Today, we commit ourselves to a process that will result in bipartisan recommendations to the incoming President and Congress to help achieve the goal that all Americans have quality, affordable coverage. But let me be clear at the outset. We believe that this goal cannot be achieved without improving how we deliver and finance health care. If all Americans are going to have coverage, we will need a more efficient system that focuses on improving the quality and the value of care. Along with my colleagues, I've invested many years of work on this issue. In the 1990s, I chaired several health care hearings around the country to listen to the problems of ordinary Americans, small businessmen and women, and providers of health care. We heard moving, often tragic stories from citizens from all walks of life who had been failed by our health care system. We heard from families who couldn't afford health insurance and had spent down to poverty, so they would become eligible for Medicaid to get care for their desperately sick children. If we took a similar listening tour today, we'd hear the same sorts of stories, but there would be more of them, and they would be even more heart-wrenching because the problems are worse. I recall my work with Dr. Jack Wenberg at Dartmouth College, one of the foremost medical researchers in the country. Nearly 20 years ago, Jack came to see me in the Senate to talk with me about the fundamental problems inherent in wide variations in practice demonstrated in studies of Maine physicians and their practices. Jack's work suggested that up to 30% of healthcare spending was unnecessary or ineffective. He talked about the issues of poor healthcare quality and about the overall absence of evidence about what works and what doesn't work. Unfortunately, in those respects, there hasn't been much improvement in recent years. As a result of those discussions, I introduced legislation to increase investment in outcomes research, which ultimately led to the creation of the Agency for Healthcare Research and Quality. While important research has been conducted by the agency and others, much more needs to be done if we are to enable and empower health professionals, patients, and others to get the best possible return on our over $2 trillion a year investment in healthcare. The effort we begin today is, to say the least, ambitious. In order for us to succeed, we will need the guidance and support of all those with a stake in our nation's healthcare system. I'm pleased that so many diverse groups and organizations are represented here today: consumers, business, labor, providers, health plans, and many others. We also have many representatives of the new Washington, D.C.-based healthcare reform movement. All reflect the reality that there is a hunger for change, and it's coming from those who know the system best. Our work will be rooted in comprehensive research and analysis provided by the dedicated staff at the Bipartisan Policy Center under the leadership of its president, Jason Grumet, as well as the Engelberg Center for Healthcare Reform at the Brookings Institution. Our efforts will be guided by two of the top healthcare policy experts in this country, Chris Jennings and Dr. Mark McClellan, who will serve as the project's co-directors. We will also work with a range of other health policy experts all across the political spectrum. We're pleased that Dr. Jean Lambrou, Associate Professor of the LBJ School of Public Affairs and Senior Fellow with the Center for American Progress, and Dr. Joe Antos, the Wilson Taylor Scholar of Healthcare Policy at the American Enterprise Institute, will be helping us with some of the technical analysis needed to support our policy recommendations. John Podesta, the president of the Center for American Progress, is in the audience today, and I want to recognize his leadership at that center and thank him for lending strong support to this project. I'd also like to recognize Chris Williams, who was my trusted legislative aide and advisor on healthcare issues in the Senate. She did a remarkable job, and we'll be relying upon her knowledge and that of many others as we move forward on this project. The great Irish poet William Butler Yeats wrote that the center will not hold. We believe that at this time in our nation's history, the center must not only hold, it must lead if we are to set America's healthcare system on a successful course of the 21st century. We don't know when or if we'll have another chance to make a difference in the health and lives of our fellow citizens. We don't know when or if we'll be able to make our workforce more productive and our businesses more competitive. So we want to seize this opportunity. We'll next hear from our project co-directors. Chris Jennings is president of Jennings Policy Strategies and a former healthcare advisor to President Bill Clinton. Dr. Mark McClellan is a senior fellow and director of the Engelberg Center for Healthcare Reform and the Leonard Schaefer Director's Chair in Health Policy at the Brookings Institution. Mark is also a former administrator for the Centers for Medicare and Medicaid Services under President George W. Bush. We look forward to working with them, and we now look forward to hearing from them. Chris and Mark, thank you very much.
Thank you, Senator, and thanks to all of you for joining us for the launch of this project. It's a real privilege for me to be here today with so many leaders and so many diverse viewpoints and perspectives. And it's a special privilege to have the opportunity to work with Senator Dole and Senator Mitchell and Senators Baker and Daschle on this matter that is so crucial to the well-being of our nation. This is a very challenging issue. It's very difficult, as you've heard already, as you already know, and we are going to approach it in a broad way. We're going to be taking a broad approach that includes 4 major elements or pillars. First is delivery. We will have a major focus on improving the quality and the cost and the value of health care. Second is coverage. In conjunction with reforming health care, we will work to help ensure access to affordable, quality health care and coverage options for all Americans. And third is individuals, people, because each person's role is important, is increasingly important in getting the right care and coverage and in maintaining and improving their health. We're going to encourage and support the role of every healthcare consumer in making health care reform succeed. And fourth is financing. We will address the difficult problem of financing our nation's health care. That's both the principal fiscal challenge facing our nation's future and a principal budget worry for our nation's households. And right now, I want to focus on the first of these, improving actual health care delivery. And that's a pillar that I think is the right place to start our efforts. As Senator Mitchell pointed out, we're going to have great difficulty achieving the goal of quality, affordable coverage and care for everyone unless we do a much better job of delivering care. If we're all going to have coverage, we need a more efficient healthcare system that not only achieves higher quality and value in healthcare today, but keeps providing more value based on better and better biomedical science. And if we're going to get to this efficient, high-value healthcare system, we need to make sure that the debate and the discussion and the action about healthcare reform is really about reforming healthcare, not just paying more for what we're getting now. Our approach is consistent with the principles that have been developed by all of the broad coalitions that are represented here today. Better Healthcare Together, the Coalition for Affordable Health Coverage, the Coalition to Advance Healthcare Reform, Divided We Fail, the National Healthcare Coalition, and also by many of the other perspectives represented here and that are going to be part of our work going forward. We're looking forward to continuing to work together as we move beyond the important principles for healthcare reform to action. And our first step on this path is coming next week. As you'll hear more about from Senator Dole in just a minute, we're going to roll up our sleeves and start working on how to combine better coverage options with better support for high-quality, low-cost healthcare delivery, higher-value healthcare. As we've begun our work, we've already identified many activities taking place all around the country that are already reforming healthcare, even though in this election year, you may not have heard about this part of the steps to address our challenges. These are steps like primary care physicians and nurses and pharmacists and other health professionals implementing steps to coordinate care and improve the management of chronic diseases. It's surgeons and specialists that are taking systematic approaches to achieve better outcomes and lower costs for their procedures. It's employers and unions reforming their health care coverage to put a greater emphasis on prevention and getting care right the first time. They're getting people more involved in making informed decisions about their care. And it's reforms in insurance choice systems like risk adjustment that are promoting competition based on cost and quality, particularly for the people who need it the most, those with high health care costs, and not just competition to select the healthiest. But often, these real health care reforms have to work against traditional health care financing and regulation. So we believe that by looking at what's actually going on around the country and listening to those who are involved in making these reforms happen, we can build up a path forward to improve coverage that will help these health professionals and patients and businesses get much better value in their care. Instead of theory or abstract policy analysis or politics, this work is going to be driven by steps that are actually starting to improve health care in America. Providers and employers and unions and consumers and insurers have not waited for federal action to start taking these steps because it's clear that whatever solution we come up with in this process, it's only going to be affordable if we reform health care so that we can spend the money much better. Unless we do this, it's going to be increasingly difficult to come up with the money to improve access to quality coverage. So these amount to systematic changes in reimbursement and benefits and the support for how health care is delivered, which in turn means higher quality and greater efficiency and improved access to quality coverage. Our work so far has given us some reasons to be optimistic. Many of the steps that I've talked about have the broad support across both parties and many stakeholder groups, and together they can amount to fundamental changes to improve our health care. So as this process begins, we want to build on what we've learned so far, and as it continues, we're looking for your input. We're aiming for a broad-based approach to turn this strong desire for action, combined with an opportunity and willingness to work together to overcome barriers, into feasible and meaningful steps forward. And now I'd like to turn to Chris Jennings to talk a bit more about how we're going to do this. Chris is an old friend of mine. We've worked together in many different contexts over the years on many subjects related to the most important ones that we're focusing on today. I know many of you here have worked with him in different capacities for an even longer time, and I can tell you there's nobody that I'd rather be partnering with to do the best we can to take action now than Chris. We haven't always agreed on everything, but we have agreed that this is the best opportunity we've had in a long time to make change happen. Thank you very much. We're looking forward to working with all of you.
Well, thank you, Mark. As I listened to you, I couldn't find anything to disagree with you about. I guess there is a first time for everything. In all seriousness, the one thing I learned from the first few years of my tenure in the United States Senate staff is that trust and respect go a long way in this town. And Mark, you have mine, and it's a pleasure to work with you on this project. Senator Dole, Senator Mitchell, thank you for your tireless support and commitment not only to this project, but to meaningful health reform over the course of your entire public service. Before I had the privilege of serving 8 years in the White House and contributing to healthcare setbacks and successes alike, I had the distinct honor of serving as a staff member in the Senate for a decade. In that capacity, it was a thrill to watch and learn from you both, as well as your colleagues, Senator Baker and Senator Daschle, to excel at one of what I believe is the most challenging and demanding jobs in the whole city, if not the nation, and that is serving as the majority leader. But as what I think is at least as impressive is that you had found time to be the leaders in the ongoing healthcare reform debate as well, both from your positions as the leaders, but also your positions on the Finance Committee. So what excited Mark and I most about this project was that you would collectively not only bring your knowledge about healthcare policy to the table, but just as important, your wisdom about the process of getting things done. So today I am here to briefly talk about the BPC process, a process that I believe will strengthen the policy recommendations we offer to the next president and the next Congress, a process that will cast a broad net to capture the best ideas and broadest investment in our eventual recommendations. Over the next 6 months, we will be holding 4 major forums around 4 policy pillars that Mark referenced. At each of those forums, we will hear from a broad spectrum of stakeholders who can move past, and this is how we will choose them, past the diagnosis of the problem to move towards prescribing practical solutions to address the indisputable challenges that we face. Each time we hear from a speaker, we will ask them 3 things. First, to highlight innovative ideas that are now working or have very great potential so to do, to discuss barriers to progress, and to provide specific recommendations for policy, federal policy, that can move the that can move the agenda forward to a time where every American has quality, affordable coverage. These forums and the recommendations we receive will be supplemented by numerous meetings with the stakeholders who are committed to constructive reform. We will reach out to every major player in the healthcare field, from large and small businesses to consumer and labor, to urban and rural interest, to special populations such as people with disabilities and minorities, to the doctors, nurses, and hospitals who care for these populations, to the plans that administer their insurance coverage, to the manufacturers of health-improving products, and finally to officials of all levels of government. And as we do this, we will encourage diverse so-called strange bedfellow coalitions, to continue their work together. The former Senate Majority Leaders bring something new and unique to this process. Years of policy and political experience in the trenches. That's what their contribution to this process, I think, will be substantial. But these coalitions that Mark already mentioned and have made essential contributions to the consensus building process, and we will encourage them to continue to do so. We believe our project strongly supplements and hopefully accelerates their work in this regard. And finally, we will fully integrate the analytical contributions that will be made by the policy analysts that Senator Mitchell mentioned. We do this not because we know that our policy objectives cannot be achieved, but because we know they must be based on a sound policy foundation. Lastly, I just want to make one point. To honor the presidential election process and to ensure that there is no distraction from it, we will hold off on releasing any policy recommendation until after this year's election. Our final recommendations will neither be a legislative proposal nor a broad set of principles, but rather a targeted set of policies that we believe will form a strong foundation for a positive and successful health reform debate in 2009. In the end, therefore, we well recognize that our process will be as important as our policy. And up front, we want to thank you in this room, as well as other stakeholders that we will depend on to help ensure that our eventual product matches what we think is our great potential. Let me conclude my remarks with just a very brief story about the first senator that I had the privilege to work for, John Glenn. Back in 1985, when the space shuttle exploded, the Challenger, President Reagan asked Senator Glenn to go down to comfort the family members. And he did. It was a very, very moving experience for him. And he did his best to share with them. And he came back to Washington, and he asked all of his staff to come share this moment with him. And he went through the whole story and how moving it was for him. And he described the odd man flyover that took place, where one plane flies up and away from all the others. And this one was very special to him. It was the most unique he'd ever seen because this plane had flown into this funnel cloud as though it was flying to heaven. And as he was expressing this and sharing this with us, he broke down and started crying. And you know, he has his bluest eyes that you'll have ever seen. And you look at this tough Marine, and he's tearing up. And his head bowed, and then it rose again, and he said, "But despite it all, if you ever have the opportunity to do something bigger than yourself, seize that opportunity." Well, I can think of no better cause than this one to respond to that charge. So with that, I'm going to turn it back to another senator who I think exemplifies and embodies the spirit of action and purpose, from his service to the country as a veteran to his service as a U.S. Senator from Kansas to his service today. I'm proud to turn the microphone back over to, of course, Senator Dole. Thank you.
Well, I first want to thank Jason, of course, and Joanne Donald for, she does all the PR. We try to get the Pope over here to get a little more coverage, but apparently he's tied up. But our timing is good because the last press conference I had was the day that I think Gordon or Scooter Libby was convicted, and that put us on page 92, whatever it was. But when I talked about the veterans, I wanted to say thank you to the Washington Post because their initial story sort of triggered a whole lot of good things. I don't say I agreed with everything they wrote, but it triggered a lot of good things, so I wanted to recognize that. And I wanted to tell you that it's been stated before, we're going to have our first 4 forums. It's going to be here in Washington, D.C., and it's going to be chaired by Senator Daschle. And as I mentioned, we'll be getting word out to you about all the details. Tom has written a book with some ideas, but he's not trying to sell those ideas. He's going to chair that particular meeting. And I think the plan is that we'll have 4 separate meetings where each of us will have an opportunity to chair, and we'll rely on Mark and Chris and the other staff. We've got a great staff to help us. And so I think that, but, you know, I listened to what Chris was just saying about John Glenn, who's a great guy. And it kind of reminded me of a little poem that I carry around and sometimes read, and I think, well, it probably wasn't appropriate here, but maybe it is, based on what we just heard from Chris. You know, we don't have a lot of time to do this. There's going to be an opportunity after the election, and I don't know how long it's going to last. But 2 or 3 years ago, a lady handed me this little poem, and it's called The Dash. I read of a man who stood to speak at the funeral of a friend. He referred to the dates on our tombstones from the beginning to the end. He noted that first came the date of her birth and spoke of the following date with tears. But what he said mattered most of all was the dash between those years. For that dash represents all the time that she spent alive on earth. And now only those who loved her know what that little line is worth. For it matters not how much we own, the cars, the house, the cash. What matters is how we live and love and how we spend our dash. So think about this long and hard. Are there things you'd like to change? For you never know how much time is left that can still be rearranged. If we could just slow down enough to consider what's true and real, and always try to understand how other people feel, and be less quick to anger and show appreciation more, and love the people in our lives like we've never loved before. If we treat each other with respect and more often wear a smile, remembering that this special dash might only last a little while. So when your eulogy is being read, with your life actions to rehash, would you be proud of the things they say about how you spent your dash? Thank you.
It's hard to follow that, but I do want to just pause for a moment and see if there are any folks who have any questions for the senators or for Chris and Mark. Just let us know who you are and ask away.
Thanks. I'm Jeff Young with the newspaper. Senators, can you talk about what might be different next year? Senator Bill, you talked about the opportunities compared to the last time something of this scale was tried.
Well, I think the obvious thing to be different next year is going to be a change of administration, change of president, put that way. I'm not saying change of administration, but there'll be a different person in the White House. There'll be newly elected members of Congress. There'll be all this work that's being done by probably everybody in this room. You know, everybody knows health care is a big, big issue. It may not be number one when people make their list, but it's not very far from the top. And so some of you are real pros. I mean, you've got spent a lot of time. And again, my friend Paul has been at this how many years? At least 60? Oh, 50. Well, I've been at it 80. So, you know, so it, I mean, so you bring all that together. And I think there is, if this is made a priority by the Congress and by the administration, and by the consumers and the providers, and all these people are going to be involved, we can get it done. But again, I think there's as I said, a dash. There's that, if we start fiddling around for 1 year, 2 years, and it's election year, of course, and then we got to wait till the next cycle, and then it's election year, and then you know what happens. You're all been around here long enough. So my hope would be that if our, under Jason's leadership and the others on our commission, or center, it's not a commission, you know, that we can help provide some impetus and get it moving I think if people could see something this big happen, say, by December of next year, it'd be remarkable. It'd be a lot of people get well on their own.
In our system, in order for major legislation to be enacted, two things must occur. The first, there has to be a broad recognition that a serious problem exists. And then secondly, there must be a consensus on what to do about that problem. For many years now, the first consensus has existed, the second is not. But it is clear from history that the broader and deeper the first consensus, the more likely the second is to be achieved. And what is different now is that with each passing year, indeed I would argue with virtually each passing day, the deficiencies and failures of the current system become more evident, and the persons failed by that system grow in number. And I think that the time has come that the first consensus is really virtually unanimous. It's no longer a consensus, it's virtual unanimity in our country that this system just doesn't work as it should, and that while there are many parts of it that perform superbly and must be retained, that the system itself needs major reform. And so we think that for the first time, perhaps in history, but certainly in a very long time, the second consensus is about to form or has formed and will support what we hope will be major bipartisan legislation.
Yeah, I think that's the point. We haven't reformed the VA healthcare system since Omar Bradley, 1956. And we've been putting little Band-Aids on it and Band-Aids, and that same thing, pretty much true. And so we need to, you know, all we can do is try. I mean, I don't think anybody can guarantee anything. But I do think the key is bipartisanship. I know that's a bad word to some people, but I think Senator Mitchell would agree, if you kind of go back and look at the major piece of legislation over the years, most of them have bipartisan support. You can make me take the medicine, but you can't make me keep it down. And so that's where it's important, and that's why I think we're going to try to keep it that way. We've had a phone call recently, two of us, and we agreed we weren't going to go out and try to announce this or that before the election. We're not trying to get this involved in the political race this year. That's not our purpose. It would be, just a disaster.
Yeah. And the need for bipartisanship is dictated by a more practical consideration. The recent history in this country, there have only rarely been Congresses in which either party has had a majority in the Senate sufficient to overcome the ability to filibuster. In other words, you have to have 60 or more senators of one party, and that has occurred only rarely in our history, and you really have to figure out a way in good faith to get serious and constructive members from both parties committed to and invested in a solution. And that is all the more so given the size, complexity, and importance in the life of every American of the issue that we're addressing here.
It's getting me to depend on a lot about how we are able to get the message out and how we work with other groups. And, when the time comes, we're all pretty much on the same page, and the people understand it. We don't want to do this unless the people understand it. That would backfire. But
speaking of filibusters, we did a pretty good job on this first question. Is there another one?
I didn't know the answer, so nothing changed.
As a reply to the American prospect, you've both spoken eloquently of the need for partisanship, and nobody doubts
that the bipartisanship could not break through.
No, it's Clinton bill. You go first.
I mentioned a moment ago the complexity and significance of the issue. And when you combine it with the complexity and difficulty of the legislative process, particularly in the Senate, it makes it very hard to enact major legislation without a broad consensus. That is, even beyond the number of 60. You can't do it if you've got 55 of one party and 5 of the other, or 50 and 10. You really need a broad consensus in this country to affect change in an issue of this magnitude. And that simply did not exist at that time. Now, there have been books written about it, and we both lived through it. Many mistakes were made by those of us who were proponents of it in terms of the decisions and how we presented it, and the complexity of the solution, which is often difficult to avoid when you have a complex problem. So we've learned from that. I think, frankly, the best thing we can do is not to spend our time dissecting the past, but learning the broad principles we've just described from it and trying to apply those principles to the future. If there's one thing I learned in Northern Ireland, it's that it is very useful to know one's history, but it is not useful to live in it. If you want to solve an ongoing and future problem, you must look to the future, and that's really what we hope to do.
And I would just add, I think Senator Mitchell's correct, but you know, whoever the new president is, I think one thing that maybe because we've been in Congress, but I think that in '94, for example, at the beginning there was a big effort to get everybody sort of together. And I'm not faulting anybody, because probably the Republicans and Democrats, you shared equally whatever. It's always occurred to me, if I ever got to be president, I don't think I'm going to try any longer, but you really need to get Congress. I mean, you need to keep your arms around the leadership, not just for the first week or 2 weeks, but if you're going to get on health care, it's got to be a weekly, really a session where you get to know each other and trust each other, and it's not just coming down for coffee and donuts. But I don't know, just little things like that can derail the whole thing. And I guess you have to be able sometimes to give a little. Reagan used to tell us, if you get me 70%, take it. And he's supposed to be the trademark of conservatism. So he understood. Well, John, you understood. You can't get it all. Get all you can. And try to sneak in the rest later. Right?
Senators, it's clear of your good intentions for bipartisanship here, but you both have alluded to the difficulties in getting past some of these philosophical differences that have gotten reaching a second consensus. And already today I've heard a little bit of a difference in one word. The word is access. I've heard someone say we want to get everyone covered. I've heard someone say we want everyone to have access to coverage. So the question is, what's our starting point? Is it that we're looking for guaranteed coverage for everybody, or are we looking for access? Which is it?
The point of an effort of this type is to begin with open minds, have an objective, and be willing to consider seriously and in good faith every point of view. The reason for the 4 pillars that were enunciated here was that they represent objectives that we're seeking. And I think it would be unwise for us to get into specifics with respect to all of the issues that we face, because it would contradict the notion of having an open mind and trying genuinely to listen to the points of view of others. That issue will undoubtedly be discussed at great length in the process. We haven't discussed it between ourselves, and it's going to be Bob and Howard and Tom and myself who will make the final decisions on whether or not we can reach agreement. So I assume you're referring to the statements of Chris and Mark, and I don't think they intended to suggest a difference, but if they did, the best answer I can give is we will rely heavily upon their advice and leadership, but in the end, we will make the decisions and we'll be responsible for them. And we not only have we not made a decision, we haven't even had a discussion yet. So I assure you that we have completely open minds. We are committed to one objective only, doing what is best for the people of this country as we can define it and hopefully reach agreement on it.
Well, I didn't hear the question, but I agree with Senator Mitchell. Our minds are open, they're not empty. You know, we're still pretty active, and we kind of know what's going on from day to day. And we're not the advisory committee just to say, well, whatever Chris and Mark come up with, send it over and I'll sign it. That's not the way we operate. And that's not the way they want us to operate. They want to be challenged. Jason, Robert Wood Johnson, funny, but wanted to be challenged. So at least that's, we've talked about it privately too, but you know, what are we getting into here?
But it's a very important question because it suggests that there will be many questions to be answered along the way, both with respect to establishing a precise objective and in answering the questions necessary to reach that objective. But, yes, Paul.
Final question.
Hey, Paul, you know Paul.
Yeah.
I want to commend you leaders, for coming together as you are, to set an example for the Congress. It's been mentioned before in our remarks, but I think if we're going to pass health legislation, you're setting the example of bringing together both parties, which will be required. And if you do nothing more than to get across the idea to the Congress, in the example you're setting, that bipartisanship is required, and it's time this country started. I commend you.
No, thank you, Paul.
Okay. Well, let me again thank Senators Mitchell and Dole and Chris and Mark. And also I want to just acknowledge the three people, my colleagues, who are really leading this effort. Cameron Lynch, who is my partner in crime, leading the Bipartisan Policy Center, and also Matt Kennedy and Kristen Leary, if you can just give the high sign. They are leading this effort day to day and will be doggedly pursuing all of you for your thoughts and input. And again, thank you all very much for joining us.